more listening and respect for mental health services would have gone a long way. A sensible discussion could have resulted in better solutions, and I would have been more confident in what was being provided. But not surprisingly, a lot of the answers to the question, what could have been done better, are personal to me. For example, I had a big problem about being sent away, far from my family, who were a vital lifeline to me. But another person might want to go a long way to get specialist care and treatment, which they have confidence in. There just isn't one answer. So what we need is choice. When we get a physical illness, we generally accept that we won't be getting much choice about where we go for specialist treatment. Maybe that's a shame, but we can live with it. And we don't have to accept the treatment if we don't want to. But I think it's a different matter when you are being forced to go somewhere against your will, especially if you've done nothing wrong. And that's what happens now under the Mental Health Act. This has gone on for so long that it is seen as normal. But just think for a moment. If the Mental Health Act was being written today for the first time, would this lack of choice be acceptable? Dozens of human rights activists would be shouting out. If you were going to detain an innocent person against their will, they should at least be able to choose where they go, so long as it achieves the objective of keeping everybody safe. That's why I set out in Joe's law that choice should be available. All patients subject to compulsion, or their guardian team, should have the option to access a personal health budget based on the cost of inpatient care, with which to design and purchase their own treatment and care package at an independent hospital or in the community, subject to the package meeting the threshold for reducing risk. As well as enhancing human rights, these arrangements could transform the whole culture of specialist services. Without choice, there is no incentive for inpatient and other services to provide a good service or even show respect to patients, and this lies at the heart of the problem. With choice, the patient is in charge and they can reject bad services and seek out those which show them respect. There is a huge therapeutic bonus too. Good compliance becomes more likely where patients have chosen the service or treatment, and so recovery is accelerated. It could be capped at the current cost of inpatient care, and it might cost less if patients choose less expensive inpatient or community-based arrangements. It might also cost less because patients would engage more with the service they could choose for themselves and so get better more quickly. The Welsh NHS routinely sends patients to private and independent hospitals at the discretion of consultants. Is it such a big step to give patients a say in choosing where they go? And we shouldn't need to wait for a change in the law to do this. As a matter of policy, the NHS could right now let patients, whether or not subject to the Act, express a preference and try to meet that choice.